Hello everyone, how are you doing? It's been a while actually. So today I'm here to talk about a female matter, not sexually transmitted infections. So before then, have you followed my page on Facebook? If you have not done so, please do STI and Female Health Matters with Dr. Tinuade. And I'm on YouTube, Dr. Tinuade, talking about sexually transmitted infections. You can subscribe to my channel. I'm on Instagram and I'm on TikTok. Just type my name, you see some of my videos. So today we are talking about premenstrual dysphoric syndrome. In an earlier video, I've talked about premenstrual syndrome. I said I'm going to take part 2 of it. So this is the part 2, but what I'm talking about is premenstrual dysphoric syndrome. These are symptoms that some people have and it can be very severe. So before I start talking about those symptoms, when we were younger, there were these people that I noticed that they used to have things, some symptoms that people tagged as, being mad, that they had issue with their head. And this is Nigeria, trust my people. So people believe that, they were inflicted with those symptoms by some witches, some wizard, and like that. And there were this stigmatization. But now I know that that is not the problem. The problem is that these people are just sick. They have what we call premenstrual dysphoric syndrome. It's not their fault and they shouldn't be stigmatized. And it's one of the reasons why I'm talking about this topic, because we have a lot of people like that. I know in this country, we don't really take many of these things serious. People just feel there's something wrong with this person. At this time, let's just leave the person alone. Why? Because the symptoms, they are periodic. What I mean is that they occur every month. That is 2 weeks before menstruation, at least 1 week before menstruation. What we are saying is that these people that have this problem, we have these symptoms I want to talk about 2 weeks before menstruation. And one of the ways to identify them is that these symptoms are severe enough, they are bad enough to affect these people daily activity at that time. Maybe they are somebody that they go to school, they will not be able to go to school. Maybe they work, they can't work. It's as that severe. So what are these symptoms? Is like extreme of emotions. What I'm trying to explain is let me explain myself. For example, some of them can be very depressed. Very depressed. They have these bad moods. They feel lonely. They feel bad. They feel the world is against them. If any one of them should have any form of rejection at that time, they don't take it so well. They take it badly. Some of them, they have suicidal thoughts. Some even have suicidal attempts and things like that. They just do things that, make them feel so bad. They are just there. Couldn't do anything. They can't. It's really very bad. That's an aspect of it. But there's another aspect of it, which is these people we're talking about, they can be very aggressive. Aggressive. Any small thing, they react to it. They can kill anybody. They can do anything at that time. Very aggressive. And there's another aspect of it, one spectrum where people don't sleep. It's insomnia. They can't sleep. Sleep will not come no matter how they tried. And there's another aspect of that spectrum, which is they sleep uncontrollably. They sleep when they are not meant to sleep. They sleep when they are walking. They just sleep when they are not meant to sleep. So it's like these extremes of emotion. Then another of these symptoms we're talking about is this binge eating. They just eat and eat things they are not supposed to eat. When they are filled up, they continue to eat and eat. And another of this symptom is this cravings for unusual things, cravings to eat blood, to eat sand, to eat dust, to eat cockroach. They just have these unusual cravings. So these symptoms are just many, but this is how you just identify them. They are more of psychological things, emotional things that happen to some people before their menstruation. So premenstrual dysphoric syndrome. And I'm sure somebody will think, what is the cause? Why do they have that? To say the truth, the cause is unknown, and that's just the truth. But we have these theories, trust medicine now, theories. We have these hormonal theories, which I'm not going to bore you with. But let's just talk about some interesting aspect of this theory, because they have to do with psychological and psychosocial issues. One of it is what we call conflict between feminism and motherhood. And this is how it is. It's like females are expected to give birth to babies. Fine. But you know, when you are menstruating, it shows you are not pregnant. So it's like there's a conflict somehow in the mind of those people that have that symptom, that have that condition. There's something in their mind that is like conflicting, that why should they be menstruating when they are meant to be giving birth? So because of that conflict and restriction, you start having all these psychological problems, psychological experiences before they have their menstrual or menstruation. There's another theory which one has to do with conflict between productivity and motherhood. And that is, okay, women, they are meant to give birth to babies, fine. But women are also meant to take care of the family, take care of the home, also work in this economic situation, even work, bring money home, and like that. And so there's this conflict between those emotions. Like, I'm not supposed to be bringing money or doing this work. I'm just supposed to get pregnant, and I'm not even getting pregnant, I'm menstruating. So it's like there's this conflict in their mind, and it just brings out some of these emotions, this anger or moodiness, this crave for unusual things, this sleeping too much, this lack of sleep, and all these type of emotions. And it's been noticed that these symptoms, this condition is severe in women in the 30s or in their 40s, severe. But that doesn't mean those people that are younger than that will not have those symptoms, but it's severe, it's bad, it's worst in people in their 30s and in their 40s. And you see, the thing about these symptoms is that when they finish menstruating that month, the symptoms will resolve. When they want to start menstruation again another month, the symptoms will start again. And we have some things we call risk factors, things that have been noticed in people with that condition that we're talking about, this premenstrual dysphoria syndrome. One of it is people that have experienced child abuse before, sex abuse before, people born in homes with domestic violence, wife battery, people that have been involved in all this child trafficking. Those are the risk factors. Some other people with maybe previous things that have happened to them in the past that have caused them to be depressed, that they've caused them to have a mood swing. So those are like risk factors, things that when people have this thing, it predisposes them. I mean, they have tendency to develop this condition that we're talking about, this premenstrual dysphoric syndrome. And it can be treated actually. It can be managed. So, but apart from that, if you have people around you with these symptoms, don't stigmatize them. That's one of the reasons for this video. Because one of the treatments for them is actually family and social support. You help these people, make them feel relaxed at that time, let them do things that they enjoy doing. We have some exercises also that they can do, and it's help them to focus on their life, not to focus on those symptoms, so that they can get out of those emotions. They are not meant to be stigmatized. It's not like they are meant to be like, this thing has happened to this person again, no, oh, it's thing, thing, those kind of behavior, the way we do for people that, I'm talking about men now that have issues with natural mental, it is like his thing has happened to him again. But now we're talking about women, so like, our thing is here again. So, no. They are meant to be given social support, emotional support, and they can come to the hospital actually for treatment. Those things can be managed very well, so that at that time, they don't see menstruation as a body. They can live their normal life and be very happy. So if you have any question on this condition I'm talking about, you can actually contact me on my Gmail, Dr. Tinuade, talking about sexually transmitted infections, 023@gmail.com. I'm going to take that again. Dr. Tinuade, talking about sexually transmitted infections, 023@gmail.com. Till another time, I'm going to drop another video. Bye.